Oh, it was off.
Gonna test.
Testing, testing. Can you hear? Test, test. It's too loud.
Yeah.
Just do it. Do it right here. Just
Oh,
do
it's
it
just his.
right there. No, no. If you do it too close, then you're gonna get a hiss. Go like this.
Okay, testing, testing. This is good. This is better. It's too high.
Just
Okay.
I'll hold the mic, and I'll tell you the number. Do you know which number's which? Or, test, test, test. It's still too high? No? No. Oh, you're not hearing it, are you? Or is it good? Nothing? I believe you. How about now? Nothing? Yours is good?
all of you are so grateful for her vision and her support, and we are delighted that she could join us today. Please help me in welcoming Supervisor Hahn.
Thank you, Dr. Farrar, for that introduction. And thank you for everybody being here. Thank you, of course, to our media who is covering this announcement because it's so important. And thank you to Martin Luther King Jr. Hospital for hosting us here and for being really one of the biggest champions of medical debt relief of any hospital in Los Angeles County. So thank you for that. Of course, it's very special for me to be at this hospital. It was my father who was the original Supervisor Hahn, who championed the building of the Martin Luther King Jr. Hospital back in the 60s when this community had no access to quality health care. In fact, one of the results of the McCone Commission after the Watts riots, when they tried to determine what were some of the root causes of the uprising, number one thing was access to medical care. These residents in this community would have to go to County General, Big General, many times taking 2 or 3 buses to get there, and many times they died of their illness or injury because they couldn't get there in time, or because they were sent home because there was no appointments and they had to do it all over the next day. So this hospital has gone through a lot of trauma itself, but it's so important that it still stands here today. Thank you for all of you, Dr. Batchelor and others who have kept this vision alive. Thank you to the many partners we have, from hospitals to nonprofits to philanthropy, who partner with Los Angeles County to take on this enormous challenge of medical debt and provide some relief to our residents. No one should have to go into poverty to get the health care they need, and yet that's exactly what's happening. Medical debt is crushing families across our communities. 1 in 10 adults in Los Angeles County are burdened with medical debt, and many of them are low income and could work the rest of their lives and never get out from under that debt. Long-standing medical debt is often bundled and sold on the secondary market for cents on the dollar to collections companies who do whatever they can to get people to pay. But through the unique partnership we're launching today with the nonprofit Undo Medical Debt, Los Angeles County is going to step in and buy much of that debt. And instead of sending a bill to the person, I love this part, we're going to send a letter to our low-income residents letting them know that their medical debt has been eliminated. Earlier this year, the Board of Supervisors approved my proposal with Supervisor Holly Mitchell to use $5 million on a pilot program to eliminate medical debt using this strategy. And since then, LA Care Health Plan has contributed another $2 million to this effort, and the Los Angeles County Medical Association has put in an additional $1 million. And because we can purchase medical debt for an average cost of 1 cent per dollar, this $8 million is enough to eliminate $800 million of medical debt for nearly 200,000 residents. Woo! This initial phase of this debt elimination program is about to begin, and people across LA County will start receiving letters telling them their debt has been eliminated as early as January. This is going to be life-changing for these families. There will be people whose entire financial futures will be different going forward once they get that letter. And that's why we can't and we won't stop with this initial investment. What Dr. Ferrer and the LA County Public Health Department have brought together is a medical debt coalition who will build on this program and use additional strategies to eliminate $2 billion in medical debt for LA County residents. This is ambitious, but with funding we have here today and what we already have, we're 40% there. You know, this is why I went into public service. This is why I went into government. People wonder, what does government do? Is government really there to help people? What we're talking about today is when LA County government is at its best. We're seizing an opportunity to help people, and we're bringing partners from across the healthcare, nonprofit, and philanthropic sectors on board to do it with us. This is going to be life-changing for families. Thank you, Dr. Ferrer, for your leadership, for your continued vision about this, and for marshaling the resources and people to actually make this happen. And thank you to every partner here today. We really will make a difference in people's lives. Thank you.
Thank you so much, Supervisor Hahn. And I also want to thank all of the supervisors. I do want to say it's such a privilege for me to work under Supervisor Hahn's leadership and the rest of our board. This work, frankly, does not happen if you don't have leadership from your elected officials. So I do want to acknowledge that, you know, we're proud to be part of this county administration because it is really all about caring about the people who need us the most. And that's what Supervisor Hahn has drilled into all of us from the first day I met her. So thank you, Supervisor. I'm grateful to all of your leadership.
And we're all women.
And they're all women, of course. But I do want to acknowledge that those of us in government know that we can't do this work without our committed partners. And I want to thank the many community and healthcare partners who have joined us today and are implementing strategies to relieve the continued accumulation of medical debt. And some people we'll hear from today, and others I'm just going to acknowledge later on in the program. But I want all of you to know we're well aware that every single person who's been part of this coalition is playing an instrumental role in getting us to where we are today and getting us to where we need to go. But I want to start also by just thanking and appreciating our hosts at the MLK Junior Community Hospital. So please, all of the staff that you see, they've been so gracious about inviting us in, and we appreciate your making space for us today. Most importantly, we appreciate all the staff for the kindness, the compassion, and the skilled medical services that they're delivering to our community residents. And yeah, so thank you. Everybody works here. You guys are amazing. And I'm always impressed. And, you know, we obviously, you touch the lives of so many people, and you save the lives of so many people. So we're forever in your debt. But I do want to recognize that here at this world-renowned community hospital, we are privileged to be joined by their brilliant leader, Dr. Elaine Batchelor. She is the CEO of the Martin Luther King Jr. Community Healthcare. She has tirelessly and courageously led efforts to improve health outcomes by insisting that we fix systems that perpetuate inequities in the distribution of the very things that people need to be healthy. Dr. Batchelor is a leader among the hospital executives in championing the need to prevent patients from incurring debt when they need care. It's my pleasure to introduce Elaine Batchelor. Dr. Elaine Batchelor.
Thank you.
You're the best.
Thank you, Dr. Farrar, and thank you, Supervisor Hahn. It's your leadership that has led us to this day, so thank you so much. As you heard from Dr. Farrar and Supervisor Hahn, medical debt has a devastating impact on members of communities throughout Los Angeles County, including our community right here in South LA. Now I'm going to tell you, I am both a physician and CEO of a hospital, and my day today started with a phone call from a debt collection agency about a medical debt they said I owed. Now, I won't go into the specifics of my situation, but I would like to share a story about a friend. A few years ago, a close friend was diagnosed with breast cancer. Today, thanks to her ability to get health insurance and good medical treatment, she's cancer-free. Yep, grateful that she's cancer-free. But to my dismay, I learned that she was once again uninsured. Why? The cost of her treatment left her mired in medical debt. She could afford to pay down her medical debt or pay for health insurance, but she couldn't afford to do both. Getting needed medical care should not leave patients in debt. And medical debt should not be the reason people cannot get care. At MLK Community Healthcare, we do everything possible to avoid placing our patients in debt. Using every tool available to us, we proactively screen our patients for eligibility for insurance coverage. We help patients apply for coverage and obtain all the benefits they're eligible for. And we estimate their family income based on the information we have. No one comes into the hospital with a tax return. And we write off charges if it falls below an affordability threshold. We take these steps because we know our community is better off when patients don't incur medical debt. The root of the medical debt crisis is the high cost of health care and the failure of health insurance to cover those costs. To alleviate the cost burden for consumers, changes need to occur at multiple levels of our healthcare system. First, public insurers like Medicare and Medicaid need to cover the cost of care so that providers aren't forced to cover the gaps with higher prices for commercially insured. Second, hospitals should stop acting as the collection arm of insurance companies, pursuing patients for copays and deductibles that have frankly become unaffordable. Third, insurance companies should design insurance products that consumers can afford. And fourth, we should all advocate for a less expensive healthcare system that puts people before profits. Better health for Americans would come at much lower cost in a healthcare system built on a foundation of public health, prevention, and primary care. Many countries have surpassed us by building health systems based on these 3 Ps. It is well known that the US health system has the highest per capita health expenditures and produces some of the worst health outcomes, including low life expectancy and high maternal and infant mortality rates. We can and should do better. I'm hopeful that LA County's new debt relief program will help people who are struggling with medical debt. In the meantime, I will continue to work toward an affordable healthcare system grounded in prevention and primary care, a system that reflects the kind of public-private partnership that will create the change we need to achieve health for all of our communities. Thank you for including me today.
You can see why we're so grateful to have Dr. Bettler here leading us, both by running an incredibly powerful hospital here that treats everybody who comes for care, but also because she actually sees where the future is and she's given all of us the game plan that we need to move forward. So thank you so much. It's also my honor today to be able to introduce and welcome Dr. Alexander Lee, the Chief Health Equity Officer at LA Care Health Plan, where he and so many others have been working to advance equity and access to health care. Recently, as Supervisor Hahn noted, LA Care made a transformative $2 million contribution towards this effort, directly supporting vulnerable families in our community. Please give them a round of applause and welcome Dr. Alexander Lee.
Well, that was a hard act to follow, Dr. Batchelor. You've always been my mentor, and just like you and others here on the stage, we're so proud to be here and see this hospital thrive for the community that we serve. Good afternoon, everyone. In the spirit of season of holidays, I think we're all blessed that we're here, gathered together here to tackle and really try to alleviate a problem that's really, I would say, demeans and really hurts a number of members of our community in a way that's harmful, both mentally and physically. And it's also sad in this season of gratitude and blessing that we also have to deal with this as the wealthiest nation in the world. and that this issue persists. So as the Chief Health Equity Officer and representing LA Care, the largest health plan and the public health plan in LA County, and really the first health plan to kind of step forward and say, we recognize that we are part of the problem, but we're also part of the solution. And we're proud as an organization, as part of our board members, our community stakeholders, that we're aiming not just to relieve the current debt, we also want to aim to relieve and prevent future medical debt that's kind of burdened our members of our society. This project really aligns, and thanks to Dr. Farrar and team, aligns, I think, with all of our values, which is to make our community healthy and well. And we believe that that can only be achieved by making sure, as many things that Dr. Batchelor said, not have people forced to make unnecessary, uneasy choices between food, housing, or health, but let that coexist together so that people can be and be healthy. We believe that this commitment, $2 million commitment, is just a start. We hope to encourage our colleagues across the industry, our partners in other sectors, whether other hospitals or providers, just like LACMA and HASC have stepped up to really participate and really be part of that solution that we call for today. So with that said, again, I think this medical debt problem has gone on for too long. We're glad that there's a solution that's moving forward, that's led by the county, and we really want to make sure that we don't want patients to skip appointments or skip their medications because they're in fear of a bill that's coming down there in the mail. We prefer that they be, I love this idea of having a gift. Let us say, your debt is forgiven. Let's move forward. So let's say again to the season of blessing and gratitude that we take this forward together for a better 2025. So thank you, everyone.
Thank you so much, Dr. Lee. And our next speaker is known by many of us for his dedication to health equity and justice and his tireless efforts to improve access to care for underserved and marginalized communities. As the Director of Integrated Services and Public Health at Kendron Community Health and the immediate past president of the Los Angeles County Medical Association, Dr. Jerry Abraham has championed innovative approaches to breaking down barriers in healthcare delivery. His work continues to inspire transformative change, ensuring that quality care is accessible to everyone in Los Angeles and beyond. Please welcome Dr. Jerry Abraham.
It's an honor and privilege to be with you all today. My name is Jerry Abraham. I'm a family physician and street medicine clinician here in Los Angeles County. Our work is on Skid Row and in South LA. I work at Kedron, which is an acute psychiatric hospital, a federally qualified health center, and also a historically black institution right here in South Central, South LA. And I'm also faculty at Drew, Charles Drew University, our nation's fourth historically black medical school in town. I'm here as the voice of over 30,000 practicing physicians in the great county of Los Angeles, and here as the face of medical students, residents, fellows, and practicing physicians who have to face patients every day who are dealing with this decision. Do I get my care or do I pay my bills? Do I pay for my rent? Do I pay for food? Or do I get my insulin? And those are real questions people are facing today. This is a public health emergency and must be treated as such. This is a national crisis, and it's affecting tens of thousands of families right here in this big Los Angeles County. Medical debt significantly impacts access to care by causing individuals, as you've already heard, delaying and foregoing medically necessary care. Imagine those surgeries, imagine that chemo, imagine those treatments that you deserve, that us physicians believe and know is the right treatment and intervention for you. But you have to make an economic decision, unfortunately. And our health insurance companies have told us, no, that's not fair and that's not right. Where did all the money go? We should be getting the care that we deserve, the care your physician wants to give you, and it should be paid for, not putting people in debt. Families face the humiliation, the indiscriminate corporate response without consideration. When you pick up that phone and you call that health insurance company when your treatment or your surgery was denied, there's no face behind that phone call, but there are faces for all of us, our patients, that nurse, that medical assistant, that doctor that is trying to do everything we can to make sure you get the care, even if it's suboptimal, because we'd much rather you get medicines Even if it's not the best medicine, then nothing at all. And that's not a decision that's fair for my colleagues, for health professionals to have to make. You should get the right care for you. And that should be paid for by your health insurance company. I'll just say in the context, when you look at what happened with the health insurance executive in New York City, the temperature is rising and people's blood pressure is boiling and people are making life and death decisions. And that is what we continue to see every day. And we don't want to see that for the families. And this is actually a health equity and racial and medical justice issue, as it does disproportionately affect Black and brown families here in Los Angeles County. We are really excited to partner with Undo Medical Debt to help local families. Our Los Angeles County Medical Association Board of Directors approved $10,000, which equals over $1 million in medical debt that will abolish medical debt for 1,750 families here in Los Angeles County. Additionally, we're really excited to be up here with all of our friends and colleagues from the county, from MLK Hospital, from DPH, from LA Care, and others. We are partnering with our Department of Public Health. There will be a convening of physicians, medical students, fellows, and residents. We want to be part of the solution. We want to figure out what we can do, and we want to raise and elevate the concerns and the voice of our patients that we hear and see every day. As you know, when we teach our students, our physicians, our colleagues, we tell them your job is not just in the exam room, but it's also outside that exam room. It's to take care of Mrs. Jones, but also understanding she lives within a family, a community, a context, a nation whose healthcare system is broken and literally is killing us. So let's all band together. Let's find a way. No one should decide between healthcare, food, and rent. People should not go into bankruptcy as a result of medical care they receive. People should not be putting all this on their credit cards. People should not be contemplating needing to drive to Tijuana to get the care they need. All of these things are not the way that we're going to get to the healthy community that LA County deserves. Thank you.
Thank you so much, Dr. Abraham, for your passion and also for all your service. We're so appreciative. Retiring debt in LA County is possible because of our partnership with Undo Medical Debt. So it's my pleasure to introduce Jonathan Wiggs, a dedicated board member of Undo Medical Debt. Undo Medical Debt plays a pivotal role in this initiative by working with hospitals to purchase and retire qualifying medical debt for low-income residents, ensuring that thousands of individuals burdened by past due bills can move forward without the weight of financial hardship. Jonathan's commitment to this work with Undo embodies the transformative impact of collaboration in addressing the medical debt crisis and promoting health justice for all. Welcome, Mr. Wiggs.
Thank you. Afternoon. Appreciate it. It's great to be here. For the last 2 years, a little over, it's been an absolute honor of mine to be able to serve and volunteer on the board of directors for Undo Medical Debt. And I have to tell you, it's a hard act to follow, but it's eye-opening. And you hear stories every single day about everything that you're hearing right now up here from all walks of life. I don't know a single person in my family. I don't have a single friend whose family hasn't been directly impacted, had a bankruptcy because of an accident, because of a critical care issue. You know, Undo was able to celebrate its 10 years this year, which is a huge milestone for us. Thank you. And we are about over the threshold of forgiving $15 billion in medical debt. It's been an incredible journey, and we're very, very excited and very grateful to be working here with LA County and the providers here to be able to continue to grow our reach, to be able to continue to make an impact everywhere that we possibly can. You know, we bring to this equation effectively a platform, a HIPAA-compliant platform that allows us to use data from all kinds of different sources, from FinThrive to TransUnion to medical practitioners and providers, that allow us to find this debt, to target it, to be able to go in and find the most vulnerable people in our communities to be able to directly address this debt. And that's a harder task than you might think. It's hard to find this. There's no open resource out there other than the debt providers, the debt collectors, in order to be able to acquire and execute this debt on behalf of our patients. So it's been an incredibly rewarding 2 years for me. I know Allison and the rest of the crew at Undo would have loved to have been here today. They are off working with other providers, other local governments on the East Coast, actually today as we speak. So we continue to try to grow this reach as much as we possibly can, bring this platform to as many patients and vulnerable folks that we can, and understand that it isn't necessarily just the financial impact, it's the chilling effect it has on people and families continuing to get the regular care that they need until it becomes acute, until they land in somebody's emergency room or on the street, not able to actually get the care that they need. And not only does that put them in a cycle where they end up unable to ever dig themselves out of that kind of medical debt, but it also puts increasing pressure on our medical infrastructure, on our emergency services, on our doctors. It really is an end-to-end loss for all of us. So again, just in closing, I'd like to thank our partners here. I want to thank the County of LA specifically for partnering with Undo and for MLK Community Hospital in hosting us today. But thank you. It's a pleasure to be here, and we're really excited to continue to work and grow the reach. Thank you.
And of course, we can't do this without that platform. There's just the logistics of actually being able to purchase the debt is something that Undo has figured out for all of us. So we're very grateful for their investment in giving us a way to actually go ahead and retire billions of dollars of debt across this country. Our community advocates have been at the forefront of efforts to eliminate medical debt for decades. And I want to acknowledge that we are blessed to have many of them as community partners and have many of them here with us today. I'm very proud to introduce Bernadette Manigault, did I say that? Who is the Director of Litigation at Neighborhood Legal Services for Los Angeles County. This is an organization dedicated to expanding access to justice and addressing the most critical needs of our low-income communities. Through their leadership, Neighborhood Legal Services has been instrumental in leveraging the law as a tool to fight systemic inequality and advance social change, particularly in areas like housing, healthcare access, and yes, medical debt. Welcome.
Good afternoon. My name is Bernadette Manigault from Neighborhood Legal Services of Los Angeles County. We are a nonprofit law firm that provides free legal services throughout LA County and has done so since 1965. We do practice in a number of different areas, including housing, immigration law, family law, workers' rights, education rights, and of course, healthcare law. I serve as a director of litigation as well as the supervising attorney of our Health Consumer Center, which has been operating for over 22 years. Every day, our unit works and fights on behalf of our clients to remove barriers to accessing healthcare, which of course includes medical debt and the fear of incurring medical debt. We have seen firsthand how it can negatively impact whole households, not only their financial health, but their mental health and their physical health as well. The thing that sets medical debt apart is that it is so involuntary and it can come upon you so suddenly. With LA County's high cost of living, the bill doesn't have to be high at all for it to knock a family off its financial balance. And most importantly, medical debt can impact you whether you are fully insured or whether you have no insurance at all. We have advocated on behalf of our clients in many ways, including overturning insurance denials, correcting billing errors, and providing representation to clients who have been unfairly and wrongly dragged into court for failure to pay these bills. As many of our partners have discussed before me, often the failure to pay these bills comes from a place of having to make hard decisions over whether to pay for food, pay for housing, or pay for a bill. In the past 3 years alone, we have relieved local residents of over $800,000 in medical debt. And while this has undoubtedly had a huge impact on those families, we recognize there is much more to be done. That's why we are so thankful for the pioneering efforts of LADPH in elevating this issue in our community and properly identifying it as a critical public health issue in this county. Their work has paved the way for strong community involvement and partnerships between legal organizations, community organizations, leaders, and providers, all seeking to address the same very important issue from all different angles. NLSLA will continue fighting for the legal rights of our county residents, and we are so proud to be part of these combined efforts to relieve the tremendous toll medical debt has had in our communities. Thank you.
Thank you so much, Bernadette. Before we close the speaking portion, I do want to note that we have many partners, and I want to call out some of them. I hope I don't want to forget anybody, but I'm going to do the best that I have. But one thing I want to note is this is a tremendous effort to buy up debt. But behind this big effort to buy up debt, we have to stop the accumulation of debt. And we have some hospital partners that have really been working tirelessly to help make sure that we don't continue to have institutions that are forcing people to choose between getting their care and accruing some debt. You know, we've heard obviously from, you know, sort of the leader here with Dr. Batchelor, but I also want to ask the CEO, the president and CEO at White Memorial Adventist Health, John Rafool. I believe he's here. If John, can you stand? He's been here for 36 years doing this work. And I want to acknowledge and thank him for two things. One is he's been doing a lot of excellent work on preventing his patients or their patients from accruing medical debt. But he also is participating in the program with Undo to make sure that not one patient that has received services at that hospital will accidentally fall through the cracks. And by that, I think he's setting an example for the entire healthcare system. Thank you for joining us today, and we're so grateful for your service here. I also want to acknowledge that Cedars-Sinai and Torrance Memorial have also been working really, really hard with hospital partners. I don't know if anybody's here from those hospitals today, but I do want to thank them publicly because, again, we do need our hospitals to participate fully in redesigning their systems, and in this case, to really allowing for presumptive eligibility so that it's very easy to identify those patients that should never, ever receive a bill. I know that we have some folks from HASC that are with us, the Hospital Association of Southern California. They've been working really closely with coalition members to bring together hospitals and coalition members and design new systems of care. I think, is Adina Tessler and Paul Young here? That's right there. Can you guys stand just so? Thank you. I think we need to give credit to how big the partnership is. And I want to note, from my perspective, I'm most grateful to the advocates who have been on the ground supporting patients and tackling outdated policies and practices for many, many years. And these advocates have been leading this work, and we joined them. So, you know, I want to give them a lot of credit for allowing us to build this really all-encompassing coalition. But I want to ask the people from the Western Center on Law and Poverty, the California Pan-Ethnic Health Network, these people should all be standing. People from Health Access California, I know you're here, from Rising Communities, from Haven Neighborhood Health Center Services, the Maternal Child Health Access folks, Communities Actively Living Independent and Free, Good Healthcare for All, and the American Cancer Society. These are people who are making this work possible. And, you know, we came together because we know that medical debt is a critical public health challenge in LA County. It affects about 1 in 10 adults. Medical debt is forcing families to make impossible choices, skipping needed medications, sacrificing essentials on food and housing, and it creates a vicious cycle. which leads to worse health, in some cases homelessness, and poverty. By joining together with wonderful partners to take action, LA County is proud to launch a groundbreaking medical debt relief program that represents this multi-sector collaboration. And with this investment, we will be relieving, as you heard, about $500 million in medical debt immediately for about 150,000 of LA County's most vulnerable residents. And we are anxious to use additional funds that are coming to us from philanthropic partners, other healthcare plans, and other investments in the community. This program, as I noted, is going to provide immediate relief to those who have accumulated medical debt. But it's the efforts we're all making to make sure that no one else accumulates medical debt that leaves our community stronger forever. So thank you. Healthcare should always be a pathway to healing. I'm grateful that we're going to continue this vital work together, and we're happy to open for any questions. I want to also thank, actually, before we open for questions, Dr. Shah, can you stand up? And the members of the DPH team, you know, I'm here, but Dr. Shah's been doing all this work. So I want to acknowledge that I'm blessed to have a brilliant team as well. And Dr. Shah has really been leading this work across this county and pushing really, really hard that we as a health department tackle financial harms as part of what we do to promote good public health. So thank you. And we'll take questions. Any questions? Yep. Oh, sure. Yes. And stand up just because it's going to be hard to see. And I'm going to ask the right person to answer.
So people who are going to be watching this are going to say, am I going to qualify? How am I going to qualify? They're going to listen to all the wonderful things you said, but they want to hear how they can apply. And does it apply to them?
Dr. Shah.
Great question. So we're going to have a lot of information on our webpage, so please check it out. But in this program, the Undo Medical Debt works directly with the hospitals. They identify all the overdue accounts. They identify eligible residents. Eligible residents are 400% of the federal poverty line and below. And you will receive a letter in the mail if your hospital that where your debt is held is participating. There's no application. Patients don't have to do anything.
And then when you talk about additional hospitals, when will we know when those other hospitals will come on board?
So all hospitals have been invited to participate and work with Undo. Some hospitals want to be named. Some hospitals want to retire their debt anonymously. So not all hospitals will be announced. But we hope to have every hospital in the county participate and look forward to working with them to do so.
Thank you, Dr. Shah. Additional questions?
Yes, Dr. Ferrer, we would like to have use of your knowing of Spanish. Would you tell us, please, in Spanish, what is this program that a lot of people is really hoping?
Muchas gracias por la pregunta. Tenemos una persona que va a hablar.
But from you, just to make it official, and then we go into a similar questioning.
Okay.
So if you just give us just a brief synopsis of how many people and why,
Okay.
Just be the
Okay.
director of.
El Departamento de Salud Pública del Condado de Los Ángeles lanzó hoy el programa de alivio de deuda médico del Condado de Los Ángeles, una iniciativa diseñada por la Coalición de Deuda Médica. Este programa es para toda la gente que tiene deuda de los hospitales, pero es los hospitales que van a participar. Okay. Otras preguntas? Other questions? And we do have somebody who will interview in Spanish.
Yes,
Okay, muchas gracias a todos. Thank you everyone for coming. We appreciate this collaboration. Particular shout out again and gratitude to the folks here at the hospital and to the leadership that joined us today. Thank you everyone.